At the beginning of August, there was great fear that the emerging Delta variant of COVID-19 would pose a new health crisis. It now appears that some of those fears may have been overstated, at least as they occurred in Montgomery County, because COVID-19 cases are beginning to recede. According to statistics reported yesterday, in the past 14 days, there's only been 1,800 new cases, or about 130 per day in Montgomery County, which is relatively low for an airborne disease. Now, I say airborne disease for a specific reason. It means that this disease is easily transferable and is with us. So, Sam, 74% of those eligible to be vaccinated in Montgomery County have done so. So why is government still pushing vaccinations? It's not going to be possible to reach 100% compliance. Why are we just pushing vaccinations as the only means of controlling COVID?
The figures that I've seen are that we need to reach 85%, and we need to do it countrywide. I think Montgomery County, under the direction of Mark Ehrlich, has done a really great job. I think the health department has, as has the county council when they sit as our health department. We're following CDC regulations. We have one of the lowest infection rates in the United States. Jurisdictions of our size, we're top 10. Our people are safe. Our hospitals are not being overwhelmed. This is the first time in the history of the United States where we've had rationing of healthcare, I believe now in 4 states, because the COVID hospitalization rate is so high, people are getting so sick that elective surgeries and other minor surgeries cannot be handled. And we're making decisions as to who to treat and who to let die. That is not right. We don't have that in Montgomery County. We're going on a right path. We ought to follow that path and stick to it, especially now that we have the opportunity to inoculate the children in our schools, which will make things better. I'm happy with the way Montgomery County is going. I know that I'm safe, I'm healthy, as are my friends and family, members of my community, and soon the kids in the schools.
Sam, much of what you say is correct, but there's some parts of that need to be parsed through. The idea that a single piece of cloth is going to protect us all from the COVID transmission, I think is a fallacy. And I'm not sure that everyone agrees that our children should be inoculated with an unproven vaccination. So Phil, is it time to get rid of the face masks and to learn to live with COVID, that we've transitioned from a pandemic to an endemic, which will be with us forever?
Not only is it time to get rid of the face mask, it never should have been imposed in the first place. Let's take a look at the history. First of all, if you go back to the 1980s, Anthony Fauci, America's guiding light on COVID, said the exact same thing about AIDS transmission. He posited that you could catch AIDS simply by normal household interactions, such as you and I sitting next to each other on the couch and watching football. He was wrong then, he is wrong now. Number 2, let's also think about something that Sam brought up. The idea that a lot of the hospitals are overwhelmed in some places. Well, there was recently a study that came out that looked at New York and found that the majority of people who were admitted with COVID, even in ICUs, were there for other reasons, and COVID happened to be in addition. Therefore, one of the biggest, and this came out in The Atlantic, a very left-wing magazine, showed that, yes, one of the most, what they say, reliable indicators of the pandemic was really not serving us well at all. There is no reason to continue this. And what is happening is, if vaccinations at an 85% or higher level is the goal, there's no reason to get there. You take a vaccine, you still got to put on a mask. You take a vaccine, your kids still have to put on a mask and can't go to school. Why are you going to do it? Hey, if we're stuck with it, why not be stuck with it? It's time for this to end. It's time for the government to eat the fact that it got this terribly wrong and move on. And look, the government's never held accountable anyway. So what's the problem?
Listen,
I want Sam to have the last word. Sam, wrap it up.
I want to point out, and all of us have written articles, that it takes a week to 10 days to get an article published. Where what we're talking about, of rationing healthcare, is a topic that came up this week. As far as comparing Fauci, back in the 80s to 30 years, which is over 30 years ago, almost 40. I don't think that that's a fair comparison either. Science
He
changed.
took the same script. He's still
Wait a
reading
minute,
from it. The
guys,
same thing.
we have
No, no.
limited time here. Just, I'm going to let Sam finish.
You just can't compare the technology that was there to define transmission of a disease in that kind of a time span. And it's absolutely been proven that the one thing masks do is they prevent, when we exhale, the further transmission of the disease, which is obviously airborne.
Well, look, Sam, I'm not going to get into disputing what you say. I don't have confidence, personally, that the paper mask that you can buy at Walgreens or CVS does anything to protect me. I think it's more to make me feel better. And unless you're wearing an N95 mask, which holds all the droplets within the mask, it's really just,
Stay tuned next week, folks, for the same debate.
Yeah, next week for the same debate. Carolyn's given us the shut up, wrap up sign. So we're taking the message. Stay tuned for parting shots.